police chief says it was evidence collected in a forensic medical exam that linked investigators to the suspect. In our continued team coverage, KAKE's Madeline Anderson explains what those exams entail and how they can be instrumental in solving sexual assault cases.
Susan, following a sexual assault, the victim is encouraged to go to the hospital to have a forensic medical exam by a sexual assault nurse examiner, or SANE. Part of that exam may include a rape kit, where evidence is collected in case the victim decides to report the crime to police. Via Christie's team of SANE nurses is helping treat the 36-year-old woman who was raped, beaten, and set on fire last week in Fairmount Park.
It is very challenging and can be very stressful when you see trauma every day.
Program coordinator Tina Peck can't comment specifically on her patient. But generally speaking, she says when sexual assault victims come to St. Joseph, they're taken to a secure part of the hospital where they receive a medical and forensic exam.
Some examples of evidence collection would be fingernail scrapings, swabbing certain areas on the body.
That evidence is then sent to law enforcement for testing. DNA is uploaded into a database so it can be cross-checked with DNA from convicted felons or anyone arrested on felony charges.
There is actually research that shows that prosecution rates have increased when a SANE is involved.
Karen Wilson Deal trained SANE nurses at Wesley Medical Center, the only other hospital in Sedgwick County that offers these services. She says SANE nurses must take 40 hours worth of classes and job shadow for months to be able to provide this kind of specialized, comprehensive care.
It's very important that even victims who don't want to report to the police still come in and have the medical forensic examination, because we can provide prophylaxis for any sexually transmitted infections they might have been exposed to. We can provide emergency contraception. We're making sure they get connected to those resources that they need, such as counseling and follow-up appointments as well.
And state law does not make victims of sexual assault report the crime to police, even if they agree to a forensic exam, although they can always change their mind later on. SANE nurses also treat victims of abuse and human trafficking. So far this year, Wesley's SANE nurses have treated 350 patients. Via Christie didn't know how many patients its nurses have treated.